Unfortunately, as we age, the volume that used to sit nice and high on our cheeks starts to settle. And it's that drooping that no one wants. And what happens is when we're younger, our eyes and cheeks are the kind of the top of a triangle, with our chin being the bottom of the triangle. But as we age and things settle, we become a nose, lines, and a jaw. And the focus is now down here instead of up here. So by restoring volume to the upper face, we can bring that youthful triangle back up to focus on your eyes. And what we're doing is using a hyaluronic acid product that is denser and holds its lift better. And we're actually restoring volume to the cheek area. It's done with a series of small injections. They're very minimal discomfort. Bruising is not common. And it's the type of treatment that gives you an immediate response. The most common reaction I see is when I place the filler on one side of the face, I show the mirror and the patient says, "Oh wow." And that's really a fun moment for me because I can see it, but patients coming in often don't realize the problem is that they've lost volume up here. And we didn't focus on this area as fillers first came out because we didn't have good products to treat in this area, but we have marvelous products now that really I love to use. And it's really amazing what putting a little bit of volume, sometimes it's out on the cheekbone, sometimes it's a little bit higher out towards the eye, and sometimes the volume loss is right under the eye. And sometimes we're distributing it into this whole area. So I'm going to analyze your face, show you what I mean, diagram for you exactly what we're talking about, and try to let you visualize what I see as the possibilities for restoring the youthful contours of that upper face area. Now, sometimes patients have an asymmetric face that they come in and tell me about. In reality, everyone is asymmetrical, but often they'll say, well, this cheek is higher or fuller, and this cheek's flatter, and that's very common. And we often will put more filler on one side than the other to account for those kind of normal asymmetries. Also, as we volumize this mid-cheek area, it sometimes helps to soften what's happening under the eye because there's often a little trough that develops here in the cheek that just needs lifted and volumized. And when we put some volume in this upper face, it often will cause a bit of softening and diminishing of the appearance of these lower lines in the jawline because we're lifting you up. And of course, it's not that exaggerated. Here, fix me and pushing up, because that would be putting a golf ball in. But putting a little bit of soft volume keeps it very natural looking and soft. And it's the kind of change that you look in the mirror and think, oh, that looks great, but nobody else can tell what's different. It's a really fun area to treat, and often it's the basis for fighting the drooping sagginess that we see in the entire face. After I place the filler in your cheeks, when you go home and wash your face that night, you're not going to move the product around. You can wash your face, put on your normal skincare. It's fine to sleep however you sleep. The product will have a bit of a settling effect, and that softens what you see right after the treatment. But you're not going to move it, you're not going to squish it. You don't have to worry that your normal activities, like sleeping, will cause a problem to the filler. We like to see you back at 2 weeks. Often we're saying, this looks great, can we put a little bit more in? Yes. Or we're saying, do I need a little bit of adjustment, and I might massage just a bit. And with cheeks, it's often a slow building process. And once we've established the cheek volume restoration, you're not going to wait until it goes away, which might be 2 to 3 years. You're going to come in periodically and we'll top it off so that you always keep the volume that makes you look so youthful.